Stomach ulcer. That painful feeling in the gut, which is also known as gastric ulcers. They are painful sores in the stomach lining. This occurs when the thick layer of the mucus that protects your stomach from the digestive juice or acid is reduced. This paves way for your digestive acid to eat away the tissues that line the stomach. This process causes a sore in your stomach, known as an ulcer. According to the National Center for Health Statistics, nearly 16 million adults in the United States are reported to have ulcers in 2014. In this video, we are going to talk about what causes stomach ulcers, the symptoms of stomach ulcers, how you can treat this painful disease, and prevention, as well as some foods you need to avoid or eat to help you heal ulcers. Contrary to popular misconception, ulcers are not nearly caused by hunger, stress, or spicy foods. Hunger and spicy foods make it worse when you already have an ulcer. Now let's see what causes it. Ulcers are mostly caused by two factors. One of these is caused by a bacteria called Helicobacter pylori. It causes about 90% of all ulcers cases. This bacteria can survive in the stomach acid because it secretes an enzyme that neutralizes stomach acid. This mechanism allows the Helicobacter pylori to make its way to the protective mucus lining. Once there, the bacterium's spiral shape helps it to burrow through the lining, which causes a sore known as an ulcer. The second factor that causes ulcers is the long-term use of inflammatory pain relievers, like aspirin, ibuprofen, or drugs that are generally classified under non-steroidal anti-inflammatory drugs, or NSAIDs. NSAIDs can cause ulcers by interfering with the stomach's ability to protect itself from gastric acids. These acids are vital to the digestive process. These acids are only safe inside the stomach. If the stomach protective barriers are destroyed in any way, this acid can cause problems, like ulcers. And that is what the NSAIDs do when you take them for a long time. Many symptoms are linked with stomach ulcers, depending on how severe they are. Here are some of them. Do you feel the pain in the stomach often? Are you experiencing unreasonable weight loss? Do you feel not want to eat because of stomach pains? What about nausea or vomiting? Do you easily feel full? Are you experiencing some heartburn? What about your stools, are they dark? Do you feel pain when you eat? Are you experiencing some anemia, which results in some tiredness or fatigue? How about your skin, is it getting paler? If you know you are experiencing some of these symptoms, you need to see a doctor. Ulcers can worsen if they aren't treated. Bleeding ulcers can become life-threatening. As noted earlier, H. pylori bacteria and long-term use of NSAIDs cause ulcers. That is why you can't treat ulcers on your own. Ulcer needs a laboratory test to confirm the cause of it. So you need to see a doctor. He may prescribe some antibiotics and drugs that have a role in killing the bacteria, if that is your cause, and may stop you from taking the NSAIDs drugs if that is also the problem or your cause of the ulcer. Symptoms of an ulcer may subside quickly with treatment. But even if your symptoms disappear, you should continue to take any medication prescribed by your doctor. This is especially important with H. pylori infections to make sure that all bacteria are eliminated. While foods do not cause ulcers, here are some foods that you can enjoy and those that you need to avoid if you are healing ulcer. A study was done in 2014 on diet and stomach ulcers. This is the result of some of the foods that are allowed. This includes milk, yogurt, and low-fat cheeses, vegetable oils and olive oil, some fruits, including apples, melons, and bananas, vegetables, including leafy greens, carrots, radishes, spinach, zucchini or courgette, chickpeas, and soybeans. Lean meats are also allowed, and natural juices. Foods that may irritate the stomach and make gastritis worse include acidic foods such as tomatoes, lemon, oranges, pineapple, excess alcohol, carbonated drinks, fatty foods, processed fruit juice, spicy foods. Others will be shared in the description below. However, if you notice your symptoms get worse when you take or eat certain foods, you need to avoid them. A 2020 research shows that taking probiotic supplements may help treat and prevent symptoms caused by H. pylori bacteria. You must also make sure that you wash your hands with soap regularly. And wash all your fruits and vegetables very well and cook them thoroughly as needed to kill all bacteria. Try to avoid or limit NSAID drugs intake if it is not recommended to you by a doctor. Talk to your doctor before buying any drugs to avoid complications. If you learned something new, please subscribe to the channel and give us a like and share with others. We will love to hear from you as well in the comments section below. See you in the next videos.